In this video, I'm going to teach you how to perform the Lachman's maneuver and a modified version of. Now, the Lachman's maneuver is basically to detect a full thickness tear of the anterior cruciate ligament. So the anterior cruciate ligament is located here, and the idea of a Lachman's maneuver is you place one hand over the femur with your thumb on top and one hand over the tibia, and it's almost like a pull and push motion. Okay, so I'm trying to anterior glide the tibia in respect to the femur, which I'm trying to posterior glide. And that's the function of the ACL, to prevent anterior posterior glide. So if the ACL has torn, then you might find you will get excessive movement coming forward. Okay. Now, the problem is if you've got big legs and you've got relatively small hands, the Lachman's maneuver is not that easy. So if you place one hand over and one hand under like this, okay, yeah, so my thumb is on top of the femur, one thumb is on top of the tibia, and I semi-flex the knee to around 15 to 20 degrees there, and then I'm going to then do a pull and a push motion. And it's not that easy to elicit motion. So what I've done, I've adapted the Lachman's maneuver, and I'll call it the modified Lachman's. The way I do this, when I place my leg under their leg, so it's resting, still around that sort of like 20 degrees, give or take, I will palpate the joint line. So my thumb and finger, if you like, is going to come onto the tibial plateau, so I can elicit motion or palpate the motion. So I'm going to palpate the joint line here, hand behind the tibia, thumb over the tibial tuberosity, and then what I'm going to do, I'm going to then pull the tibia anteriorly, and I can feel a couple of millimeters of motion under my finger and thumb, and I'm going to push where there's no motion. So I can definitely feel an anterior glide. Remember, this would be the asymptomatic knee, where we have no symptoms. So I would have tested this one first to see what's normal. And if this one had, say, 2 millimeters of motion, and this one had maybe 8 millimeters of motion, then I would suspect there is a thickness tear, or as in a full thickness tear of the cruciate ligament. This one is more sensitive, so they say, compared to the anterior draw test, because this one, with a draw test where the knee is at 90 degrees and you pull, if you've got a posterior horn tear of the meniscus, it would stop the motion. And if the hamstrings are in spasm, potentially it would stop the motion. Whereas this one is more sensitive. But remember, the way I do it, palpate the joint line, hand behind the tibia, and apply a anterior pull-in type of motion. So it's reminiscent of a draw test, but just done in a slightly different way. So I call this one the modified Lachman's maneuver, and it works very well for me. Thank you for watching the video, and I hope you enjoyed the presentation.